You've got tinnitus, that ringing or buzzing sound in your head that no one else can hear, but you can't ignore it. It's driving you crazy. So you go and ask your doctor about it, and you're told, there's nothing we can do. You're just going to have to learn to live with it. That moment right there is where so many people get stuck, not because there's no help, but because no one took the time to ask the right questions.
If you're navigating hearing loss or struggling with ringing in your ears, then you've come to the right place. The All Ears Hearing and Tinnitus podcast is your go-to source for expert insights, real stories, and cutting-edge solutions in hearing health. We'll dive into the latest advancements in hearing healthcare, explore groundbreaking treatments for tinnitus, and offer practical tips for better hearing. Here to help you tune into a world of better hearing, here's your host from Timpanogos Hearing and Tinnitus, Dr. Layne Garrett.
Here's what most people don't realize. Tinnitus isn't just one thing. There are actually 4 different types of tinnitus, each with different causes and different treatment options. And yes, I did say treatment, but if you don't know which type you have, or if you're being treated the wrong way for the wrong kind, it's no wonder that nothing's working. I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus, and I've spent over 20 years helping patients find real relief, often after they were told that there was no hope. And today, I'm going to break down the 4 main types of tinnitus, how to tell which one applies to you, and what proper treatment actually looks like. Before we get into the different types of tinnitus, let me tell you why this actually matters. Research shows that tinnitus can be caused by everything from blood vessel problems to jaw issues to hearing loss, and each type needs a different approach. Every single week, I see someone with pulsatile tinnitus that matches their heartbeat, and they've been given sound therapy apps and told to learn to live with it. That's just not unhelpful, it's potentially dangerous, because we might be missing vascular issues that need medical attention. Or someone with somatic tinnitus who can literally change their tinnitus by moving their jaw, and no one's ever bothered to adjust their TMJ dysfunction. They've spent thousands on hearing aids that were never going to fix the core problem. This isn't about getting fancy with categories. This is about not wasting your time and your money on the wrong treatment. Let's start with the most common type, primary tinnitus. This is what most people have. Primary tinnitus sounds like high-pitched ringing, buzzing, hissing, or whistling, and it's constant or sometimes comes and goes. It's usually in both ears, and it feels like it's in your head. And it's often worse in quiet places because there's no other sound to distract you. Now here's what's going on. Primary tinnitus is connected to hearing loss, even when that hearing loss is so subtle that you might not even notice it yet. A 2018 study from Harvard Medical School found that people with chronic tinnitus had damage to their hearing nerves even if standard hearing tests looked completely normal. Their brains were also more active than they should be. So what's going on? Your brain is constantly monitoring the sound information it's getting from your ears. When it detects that certain things are missing, even if you can't consciously hear that that's missing, it tries to compensate by turning up the internal volume control. That compensation is what creates the tinnitus in the first place. But why do standard hearing tests sometimes miss this? Well, the damage is often in very specific areas. It might be in the ultra-high frequencies that clinics don't test routinely, or it's damage at the nerve level that doesn't show up on a regular audiogram yet. This is where proper evaluation becomes critical. You don't just stop at a standard hearing test. In our clinic, we do special tests like otoacoustic emissions that check to see how well those little inner hair cells in your cochlea are actually working. We test extended high frequencies that go way beyond what most places are going to measure. And these tests almost always reveal the underlying changes in your hearing that are driving that tinnitus. When I evaluate someone with primary tinnitus, I need to know, do you have hearing loss driving this? Because if we do, we need to address that first. The research shows about 75% of people get meaningful relief from properly fit hearing devices, but those hearing aids need to be fit correctly with real ear measurements. Without that verification, you might have premium technology that's set up all wrong and not helping your tinnitus at all. Something else you won't hear anywhere else. For primary tinnitus, hearing aids work best when combined with other approaches. Just the hearing aids alone. Good results? Add counseling about how your brain works, sound therapy protocols, and appropriate lifestyle modifications, maybe some cognitive behavioral therapy techniques, or adding in bimodal neuromodulation like linear. Now our success rates are over 90%. That's what proper treatment looks like, addressing what's actually driving the tinnitus. You'll see advice online and even from some audiologists to download apps or use white noise. but that's just covering it up without solving the underlying problem. Now let's talk about secondary tinnitus. That's different. This is where there's a specific cause that we can identify and potentially fix. Secondary causes include jaw problems, ear infections, certain medications, head or neck injuries, inner ear diseases like Meniere's disease, or even just earwax. People waste months or years on this because they assume all tinnitus is the same and they jump straight to sound therapy or expensive hearing aids without ruling out these very treatable causes first. Let me give you an example. I saw a patient who came in with bothersome tinnitus that started about 6 months before. She'd already bought over-the-counter hearing aids, and when we checked her ears, we found that there was just a lot of earwax in her left ear. We removed that wax, and within a week, the tinnitus was gone. She'd wasted a lot of money and 6 months of frustration. Then there was my recent patient who developed tinnitus after starting a new blood pressure medication. Nobody had bothered to ask about medication changes, so when we worked with his doctor to switch medications, his tinnitus went away within a month. What frustrates me about the learn to live with it advice is you don't have to learn to live with it. Sometimes there's a fixable cause that nobody bothered to look for. Medical guidelines say finding and treating these causes should be the first step, but most places don't do that. They just skip straight to, here's some hearing aids, or just use a sound app without ruling out those fixable things first. And that means people are getting treatment that's never going to work for their situation. All right, now we're getting into the less common but really important types, like pulsatile tinnitus, which represents about 5 to 10% of all tinnitus cases. Pulsatile tinnitus has a rhythm that matches your heartbeat. It sounds like whooshing, thumping, or a rhythmic pulsing. And unlike the ringing type, this sound is often being created by actual blood flow in your body. I've had patients tell me they mentioned this to their doctor and were told it's just tinnitus, just ignore it, and that's not good enough. A recent study emphasized that this type of tinnitus requires careful evaluation because missing the diagnosis can have serious health consequences. Pulsatile tinnitus can be caused by things like blood vessel problems, bulging arteries, blocked veins, or pressure buildup in your skull. And some of those are life-threatening if not found and treated. So when someone describes pulsatile tinnitus to me, they're getting an ENT referral. But first, I verify it's actually pulsatile by having them count their tinnitus pulses while we actually count their pulse. If those numbers match up, that confirms we're dealing with pulsatile tinnitus, not just rhythmic primary tinnitus. Not all pulsatile tinnitus is dangerous. Most of the time it's annoying but harmless, but we don't assume that. We verify that. And that requires proper medical workup that's outside my scope as an audiologist. The good news, when the specialist identifies the cause, treating it often makes the pulsatile tinnitus completely disappear. I've had multiple patients whose tinnitus went away completely after treatment, but only because we didn't dismiss it as just tinnitus or try to just give them a hearing aid or an app. Finally, let's talk about somatic tinnitus. This is one of the most commonly misdiagnosed types of tinnitus in my experience. Researchers from the University of Nottingham found that people with this type of tinnitus can change their tinnitus by clenching their jaw, moving their head, pressing their face, or sometimes just moving their eyes. And what I see happen all the time is this. Someone tells me they can make their tinnitus louder or quieter by moving their jaw, but they weren't asked that during their evaluations. So they get treated for regular primary tinnitus with hearing aids and sound therapy. Those things will help, but they're missing the main driver of the problem. A 2015 study found that people with somatic tinnitus were more likely to be younger, like under the age of 40, have jaw complaints, and say their tinnitus changes throughout the day. This matches exactly what I see in practice. During evaluations, we always check for somatic tinnitus. If certain movements change your tinnitus, I'll have you clench your jaw, move your neck, press on different areas. I want to know if physical movement changes things. That tells me we need to address those physical factors, not just throw hearing aids at the problem. The treatment approach is different. Yes, we're probably still going to use hearing aids and sound therapy if there's a hearing loss, but we're also going to need to address the jaw dysfunction or the neck issues or whatever's creating that physical trigger. This might mean working with a physical therapist, getting treatment for TMJ, or doing specific exercises. The do-it-yourself approaches that you find online here fall short because you can stretch your neck or work on not clenching your jaw, and that might help a little, but if we don't figure out why your neck or jaw is creating this response in the first place, whether it's structural issues or nerve hypersensitivity or something else, we're just treating symptoms, not solving the problem. So how do you know which type of tinnitus you have? These questions can point you in the right direction. For primary tinnitus, is your ring constantly there? Is it a buzzing or hissing sound? Do you have hearing loss? Is it worse in quiet places? Does it stay the same whether you're moving or standing still? For secondary tinnitus, can you pinpoint when it started? Did it start with a new medication, an ear infection, a dental procedure, or a head injury? Did something specific happen around that time? For pulsatile tinnitus, does the sound have a rhythm that matches your heartbeat? Can you count the pulses and match them to your pulse at your wrist? Is it whooshing or thumping sound and not ringing? And then for somatic tinnitus, can you change the loudness or pitch by clenching your jaw, moving your neck, or pressing on your head or face? Do you have jaw problems or neck pain? Does the tinnitus get worse in certain head positions? Now the reality, and this is important, some people have more than one type. You might have primary tinnitus from a hearing loss plus somatic components from jaw problems, or secondary tinnitus from medication plus hearing loss making it worse. This is exactly why professional evaluation matters so much. The goal isn't to fit you into one category. It's to understand all the factors contributing to your tinnitus so we can address all of them. Not every audiologist or ear doctor specializes in tinnitus. And I'm not just saying that to promote my clinic. This is a real problem in our field. I've seen patients who went to other clinics and were told, we can't help you, when they actually had very treatable tinnitus conditions. Or they went to a so-called tinnitus specialist and got hearing aids without anyone checking to see what type of tinnitus they had. No somatic testing, no medication review, just straight to hearing aids. If you're dealing with bothersome tinnitus, look for clinics where the audiologists have a certificate holder in tinnitus management from the American Board of Audiology. This certification means specialized training in evaluating and treating the different types that we've talked about today. You also want to get to a clinic that does comprehensive testing to identify what's actually driving your tinnitus. Then look at the treatment options. If they recommend hearing aids, do they verify those settings with real ear measurements? Do they offer cognitive behavioral therapy education? Do they talk about lifestyle modifications? Do they have advanced treatment like Layne? Can they coordinate with ENTs, physical therapists, or TMJ specialists when needed? Because if all a clinic offers is hearing aids and sound apps, that's probably what they're going to recommend, regardless of what type of tinnitus you have. When you come to our clinic, we're going to check for all four types: somatic testing, medication review, proper hearing evaluation using extended frequencies and otoacoustic emissions. If we find pulsatile tinnitus, you're going to get that ENT referral. The bottom line is tinnitus isn't just one thing, it's a symptom, and it has multiple causes and types. Getting the right diagnosis up front can save you years of frustration. And if someone's treating you without figuring out what type of tinnitus you have, that's a red flag. Now, I want to hear from you. If you have tinnitus, which type do you think you might have? Have you been able to change it with any movement of your jaw or neck? Is it pulsatile? Has anyone actually done a comprehensive evaluation, or they just assume what type of tinnitus you have? Drop your comments below. Your experience helps other viewers understand what proper care should really look like. If you want to learn more about comprehensive tinnitus treatment, I've put together a free online learning center with detailed information about different treatment options and what actually works versus what's just marketing hype. You can find a link in the description. And if you're here in Northern Utah and want a good, proper tinnitus evaluation, not just a guess, you can schedule an appointment with us online. That link is also in the links below.
A world of better hearing and relief from tinnitus is within reach, and we're here to help. Be sure to subscribe to the podcast right now and join us on the journey to clearer sound and a richer life. Thanks for listening to the All Ears Hearing and Tinnitus podcast with Dr. Layne Garrett. We'll see you next time.